And welcome back. Now, South Africa's public health system has been allocated 21.5 billion rand more to fight the COVID-19 pandemic. But there's no strategy to guide how it should be used. And this is according to Professor Alex van den Heever, a health economics and financing specialist at the Wits School of Governance. And referring to the supplementary budget tabled last week by Finance Minister Tito Mboweni, Professor van den Heever says that while the exercise was meant to make more money available for the fight against the COVID-19 pandemic, it actually sheds no light on prioritizing prevention over the treatment of the virus. Does this then speak to a bigger problem of planning, policy, public accountability and governance in South Africa? Well, to answer this, joining us now via Zoom are Dr Mbongiseni Buthelezi, the Executive Director at the Public Accountability Research Institute, and Professor Alex van den Heever, who is a Health Economics and Financing Specialist at the Wits School of Governance. Gentlemen, thank you so much to both of you for making the time, and welcome to Morning Live.
Thank you, Sakina. Nice to talk to you.
Professor van den Heever, if I could start with you. This is, of course, your area of specialization, but what could have been done differently? What would you have said would have been the ideal approach to this budget by Minister Mboweni?
So firstly, a budget is meant to be an exercise in transparency regarding government policy, and therefore it's not merely meant to reflect the numbers that you produce. And out of the 21 billion, so slightly more than that, sort of 21 billion allocated, a very substantial portion is merely a supplement to the existing provincial equitable share allocation. Now, it's important to understand that the provincial equitable share allocation is an unallocated transfer from national government to provinces purely on a formula basis, and it's not dedicated to health. So it's very odd that within the budget there's 16 billion rand that is essentially attached to an unallocated budget that the provinces have complete discretion to deviate from. So it's very unclear exactly what that money would be spent on and whether or not it's going to be correctly prioritized between prevention and treatment. And as I pointed out in analysis, it's absolutely critical to have a very clear strategy in which you differentiate between the prevention side of this epidemic and the treatment side. We will never cope with treatment if our prevention fails. So that is quite key. And the national allocation, it's completely unclear. There's about 6 billion rand left there for national to transfer, and it's also unclear exactly how that would be spent. So we have numbers, but we don't actually have a strategy.
So talking about that missing strategy, what exactly would that look like? What are those missing strategies, and what are those attributed to, these misses that you're talking about, Professor?
So if you differentiate the strategy into prevention is where you invest in testing and tracing, for instance, where you're testing people, you're tracing all contacts and you're quarantining people. So that process itself is fairly labor intensive. It needs to be done rigorously on a daily basis. It needs to have a strategy behind it. It's done at scale. It's also relatively expensive. Now, our testing strategy has been unsuccessful to date in the public sector, and there's clearly been an underinvestment in that. Now, if you do not test and trace, a huge part of your prevention strategy is disabled. So that's one part of prevention. Other parts of prevention include the protection of frontline workers, your PPE, as well as investment in ensuring and regulating compliance with health protocols on all the areas where transmission is very probable in communal spaces such as shopping centres, funerals, etc. So I see an underinvestment in how we manage that, and as well as the testing and tracing. On the treatment side, we have actually seen very little movement in the creation of additional bed capacity, but it's important to note that we could spend billions on additional bed capacity and we will still be overwhelmed if we do not prevent. So we have to spend and we have to invest in the prevention strategy. So the 16 billion rand, and a further concern is that different provinces are experiencing different stages of an epidemic or different trajectories as a consequence of the quality of their prevention strategy. And you want to make sure that the funds are being allocated to attack that growth in the provinces where they're happening. So with the equitable share allocation, they've equally divided up the money between provinces that don't have a problem at the moment and those that have a massive problem. And I think that that is a huge mistake. So I think that the money should have been retained substantially at a central level and allocated based on a strategy that's very clear, on a conditional basis or by national expenditures directly to where the needs are greatest. And we don't see that at the moment. And it worries me that this very passive approach to financing a strategy is essentially acquiescing to failure at the end of the day in managing the epidemic.
Dr. Buthelezi, listening to what Professor van den Heever is saying and looking at this amount of 21 billion rand, what would you say is the risk of having such a huge sum of money with no clear strategy and conditions attached to it?
The risk, I think, is that there will be a lot of effort and a lot of this money spent, but very little to show for it at the end. I think Professor van den Heever is right in that if we go this route, chances are that over the next few months, the healthcare system is indeed going to be overwhelmed. And a lot of money and effort is going to have been spent on responding to this, but misplacing the response so that ultimately, when we get to a point where the healthcare system is overwhelmed, we are not going to see a return on the investment that's going to be made. So that's the one part of it. The other part of it is that crises, we know the world over, also are used as opportunities for rent-seeking, for looting. So this also opens, if the money is allocated to provinces in this way, through this equitable share, there's a great deal that, a great possibility that a great deal of that money also might be misspent. We've seen recently that, in the AG's report, that a lot of money is being misused, partly because of mismanagement, but also partly because there is a great deal of corruption that takes place. So that's the other risk that we run here, that a lot of this money might also then be misappropriated by people who are trying to enrich themselves, taking the opportunity of a pandemic to loot state coffers.
And as Professor van den Heever points out, part of the reason for that, and that would become almost an enabling situation for the looting and corruption to take place, is this issue of missing strategies. But how prevalent are these missing strategies? How prevalent is this problem in the country, whether it's in the area of policy, planning, public finance, or even accountability, Dr. Buthelezi?
I think that's one of the biggest problems we face. What the pandemic, I think, for all of us to see makes visible is that, as much as there are immediate interventions, there are things like the Solidarity Fund that has done an incredible amount of work. What you need is an underlying system when a crisis hits, an underlying capable state system where the administration is able to do its regular run-of-the-mill work that it needs to do. Now, that's one of the areas of great weakness in our state, in South Africa. We don't have public administrations that are fit and capable. We don't have fit-for-purpose public administrations. So this money being dispersed into public administrations that are not fit for purpose, there's a big opening that because the administrations are not operating as they should, that this money is just going to be misused. It's a generic problem in South Africa. That's why we see in every report that the Auditor General releases, there's always, they're always pointing out that there's an issue with public administration. Basic administrative duties, basic record keeping is not being done. So money cannot be accounted for. Money that then is allocated to provinces, allocated to local government. A lot of it might be used for the purposes for which it's allocated, but it cannot be accounted for because just basic administration is not up to scratch. It's a problem we see also when it comes to planning in the country. As much as the National Planning Commission has been trying for many years to put in place a framework, we are seeing that at various levels, again, because of the inability of our public administration to be fit for purpose. It has, because of the underinvestment in building public administrations that are fit for purpose in South Africa. I think it's been a chronic problem over the last 20 years. The planning function is very, very poor in South Africa. And so municipalities spend a lot of money without any proper planning. When it comes to procurement, for example, procurement is often haphazardly planned, but it's also used as an opportunity for rent seeking, partly because of too much politics in our administrations. It is space that has been opened up where people who are not up to scratch, people who don't have the qualifications, don't have the experience, are appointed into positions where they open the doors, I think, for networks of politicians, of business people, of state officials to loot state coffers. This is a problem that we're seeing, and it's a consistent problem that has developed. In fact, is deepening in South Africa, has deepened over time. The current administration, I think, is putting a lot of effort into trying to turn the situation around. But in the midst of a pandemic, all of this is being exposed in new ways at a new level, and urgent attention needs to be paid to these things.
Professor van den Heever, last week the Gauteng Health Department tabled a 55.7 billion rand budget, and the Health MEC, Dr Masuku, said that this was slightly lower than last year's budget. What did you make of the allocations there, and also looking at the situation right now as we move into the storm, as the Premier put it yesterday, of this COVID-19 pandemic in Gauteng? What do you believe should be prioritized?
To a large extent, the current budget allocated for this financial year would be largely following the last year's budget. So the strategy in the budget is going to be minimal. So they would largely be continuing to pay the salaries of staff and the existing structure of the health system. And they would also be paying out for testing, and they will potentially be contracting with the private health system for overflow out of this current budget. So they would be struggling if they go into the surge in this province without a supplementary budget. Gauteng, because it's got the largest population in South Africa, and because it's effectively lost control of the epidemic because of an absence of a coherent prevention strategy, is going to suffer greatly and is going to need to spend money with much more effectiveness than it has to date. So on the one hand, there are the resources that are indicated in the budget. On the other hand, there are the platforms which allocate the money and spend it and operationalize the decisions of the province. In terms of the latter, it's unclear that they are effective at what they are doing at this point. And from a prevention side, you need to have a very effective testing strategy. So there's one issue is the amount of money that you're spending on testing. The other is how you're strategically managing your testing process, and how are you then currently identifying clusters and hotspots, and what are you doing about it? Requires a very agile response. It's not just the funding. You've got to have a platform that can move very quickly and do things on the ground that addresses the problem. So those are the things that need to be done without thinking about whether or not you've got enough budget. Because every time you ration in that environment, you allow the epidemic to run away from you. So at this point, South Africa should have been financing a coherent strategy for prevention fully, without concern for a ceiling on that expenditure, because the impact on the economy and the impact on society of not doing so is so devastating that you should fully fund prevention. So fully funding prevention it can get you so far. But if you fully fund it and have really bad strategy, that's now the specific strategy of how you targeted spending, you're also going to squander and waste that money. So to me, this is where this province in Gauteng needs to prioritize very effectively. But there isn't really complete transparency about what is being done and why they're failing. So we don't really have specific information on the hotspots and exactly how they're targeting them. We have general information and a few briefings. So I think going forward, I think the population, people who are basically depending on government doing its job, need to know exactly what they're doing. They need to know how effective it is. And I do want to make one point about this idea that there was some sort of expected storm coming. This is nonsense. The trajectory of new infections that we're seeing now is entirely a consequence of the absence of prevention. It's not something that was predicted or expected. It should have been stopped. So every country that has so-called peaked their epidemics, or even provinces in South Africa, such as the Western Cape, have done so because they have actively engaged the epidemic. They've got ahead of it. They haven't waited for it to run away from us. And when we introduced the lockdown, the epidemic was not running away from us. It was at very low levels. And it was we were in a very, very good position to implement first-rate prevention strategies, and we didn't do it. So what we're seeing now wasn't predicted by a model. It wasn't predicted by science. It's entirely a consequence of bad policy.
So how do we reverse it? Because we are now faced with a very real situation whereby we are seeing record numbers of new infections every day, Professor.
We essentially have to aggressively attack it, and we have to know what they're doing. So on the one hand, it's quite difficult to know specifically what has failed in the strategy because there isn't enough information on what this province has been doing. We are completely blind as to the contact tracing platforms, for instance, that have been set up. There is some mysterious contact tracing platform set up within the CSIR. There's no transparency as to what they are doing. Other countries, such as South Korea, they had their contact tracing platform set up with public-private collaborations in January. They had their testing programs expanded in January. South Africa still, to date, hasn't got either of those in place. They've indicated that there are bottlenecks to testing internationally. Everybody's trying to buy the reagents, trying to buy and so it's difficult. But South Africa's private sector now is testing substantially more than the public sector, and they are facing supposedly the same supply chain constraints. So why are we supply constrained? So the issue is what the tried and tested method of attacking an epidemic is testing, tracing, quarantining. That's the pillar. Beyond that, there is very effective control of the community spaces where transmission occurs and is going to be high. And we have to manage those. So that's shopping centres. That will be, we're allowing funerals where 50 people can come to them. We're not properly managing taxis. We're not properly managing buses. These prevention in those environments involve an understanding of transmission in the air. Anytime with a mask that you're sitting in a room with somebody else who's COVID positive, it doesn't matter whether you're wearing a mask or socially distancing, you are very high risk of being infected. So we don't even have any strategy to deal with ventilation in all of these areas. So these are all areas where we're probably experiencing what's called the super spreading events. So a large part of this epidemic is caused by a few people infecting a large number of other people in particular contexts. If you manage to attack those super spreading events and super spreading contexts, you are going to substantially contain the epidemic. And what we're seeing now suggests that we are not containing those super spreading contexts very well. And we basically have to up our game in getting to those. We cannot basically wait for this epidemic to run its course.
And we are running out of time as well. I just want to ask Dr. Buthelezi very briefly, how respectful are we as a country of public finances, of accountability? And if you were to rank us, Dr. Buthelezi, looking at the issues that Dr. van den Heever outlines now, and we know already there have been citations of issues of corruption with the COVID-19 funds, how would you rank us? How are we faring and how respectful are we?
We are not ranking terribly well. I mean, if you look at things like the Corruption Perception Index or the Ibrahim African Governance Index, South Africa, the trend over the last 10, 15 years has been South Africa has been on a downward trend. We are in decline. We have been in decline. And what we're seeing now what Alex was talking about, I think are the effects of accountability systems that have been weak over time, both to the public, but also when it comes to the use of public money, but also internally within organizations of the state, within political parties. That is the effect we're seeing now of those problems. The issues of being ineffectual in our strategy, as Alex is talking about, that also I think has to do with our institutions. The weaknesses of our institutions are being exposed in a very dramatic way at present. Where we should have been is with institutions that could respond to this, but the politicization of institutions over a long time has meant that we've arrived at this moment with institutions that are just not able, not agile enough, are too beholden to political imperatives to be able to do their jobs effectively. And that is part of what is being exposed in the big problem that we face at the moment. Accountability mechanisms that have been weakened. Some of them have been weakened systematically and deliberately in order to, again, open the doors to rent-seeking, to the stealing of public money. Others have just been through neglect. The health systems in the Eastern Cape, for example, have suffered from both of those things. Neglect on one hand, which is kind of benign, I think, but also systematic weakening for purposes of stealing public money. And this is what we end up with. We end up in a situation where when the institutions are needed to step up by the public, by all of us in the country, they are simply incapable. And so we end up with a lot of improvisation. And that's what we're seeing now. The incoherence of the strategy, I think, is a result of players in the state having to simply improvise things, having to do things on the hoof, when on a regular basis, institutions should have been able to do these things, should have been able to procure materials that are needed, deliver them to the right places at the right time, in the right quantities, but our institutions are not able to do that. And so going forward, we need to be now, in this crisis, be setting up our institutions for the long-run future. This is where we need to use the opportunity of this crisis to begin to turn things around in the country.
Well, thank you so much to both of you, gentlemen. Professor Alex van den Heever from the Wits School of Governance and Dr Mbongiseni Buthelezi from the Public Accountability Research Institute, discussing budget allocations, prioritization and accountability with us, especially during this time of COVID-19 and what those are likely to lead us to. So thank you so much for highlighting some very important issues. It is 8